Hello, I am John O'Brien, and this is going to be my presentation on hemophilia. So a little backstory on the root of the word hemophilia is hemo means blood, and philia means love. So it means blood love. It's not referring to someone who loves blood, but rather someone who loves to bleed, in the sense, and that'll make more sense as I continue on in the presentation. So, the chromosomal abnormality that causes hemophilia is a faulty gene located on the X chromosome. So since on the X chromosome, it's also an X-linked recessive gene. Almost always occurs in boys because of that. It's passed down through the mother. Women with the gene are often carriers, and they experience no signs or symptoms of the gene because they'd have two X chromosomes, and one of them would only, and the one with the abnormality is recessive. So you can see that further in the next slide in this chart. So here you have a father with an X and a Y chromosome. You have a mother who is a carrier of hemophilia with one abnormal chromosome and one normal chromosome. So they have a child, their offspring has a chance of being any one of these combinations. So you can have a son with one of the normal X chromosomes and a Y chromosome. You can have a daughter who would be a carrier because they have one abnormal chromosome and one normal X chromosome. And then you have here, this son would have hemophilia because he has the X chromosome that has the abnormality, and the Y chromosome would yield to the X chromosome and cause the person to have hemophilia. And then daughter could also have two normal X chromosomes and not be a carrier. So you see in this one over here that the father is the one who's carrying hemophilia. The mother does not have it. So if the father has a chance of so any of the daughters the father has will be a carrier of hemophilia and can pass it down to their children as well. So normal versus abnormal situation. So normally the clotting factor and the platelets work together to clot the blood in a wound in order to stop the bleeding. With hemophilia, the abnormal thing that happens here is the lack of blood clotting proteins causes blood to not clot properly. So there's two kinds of hemophilia. Hemophilia A, or classic hemophilia, is the most common form of hemophilia. It affects factor 8, the clotting factor 8, while hemophilia B affects clotting factor 9. You can see here a picture of the process of hemostasis, which is the clotting and healing of a wound. So the process starts, you see here, there is bleeding occurring, the blood vessel constricts, and primary hemostasis begins, where the platelets come and they form a clot. And this is the part where hemophilia comes into play, because in secondary hemostasis, the clotting factors are supposed to be activated out of the blood and begin the process that leads to the fibrin or scar tissue being created, and evidently the wound to stop bleeding and to be healed. But because of the abnormalities, these clotting factors do not do that, and the wound does not heal properly. Depending on the severity, This can cause a multitude of problems. Some of the symptoms here for that would be spontaneous bleeding. So that can include unexplained and excessive bleeding from cuts or injuries, or after surgery or dental work. Many large or deep bruises, unusual bleeding after vaccination, pain, swelling, or tightness in your joints, blood in your urine or stool, which is indicative of internal bleeding, a major concern of for people with hemophilia. So, as well as nosebleeds without a known cause, and in infants, unexplained irritability. So another major concern would be bleeding into the brain, and some symptoms of this would be painful, prolonged headache, repeated vomiting, sleepiness or lethargy, double vision, sudden weakness or clumsiness, convulsive seizures. So if someone with hemophilia was experiencing any of these symptoms, it would be advised to them to go see a doctor. If anyone is experiencing these symptoms, they should also go see a doctor regardless of whether or not they have hemophilia. Alright, so here we have a chart. You see that 60% have severe hemophilia, 25% have mild hemophilia, and 15% have moderate hemophilia. So in this chart, the number of people identified with hemophilia, hemophilia A, as of 1999, was 53,864. In total, with hemophilia B and unknown, it would be 78,692 in 1999. You see in 2018 that number increases to 210,454%. 210,454 people. So that's a 204% increase in the number of people with bleeding disorders identified since 1999. So you also come into other bleeding disorders like von Willebrand disease, which can affect women as well, and is especially dangerous for women due to their menstrual cycles. And then other bleeding disorders, of course, as well. So the cure and treatment for this is, so there's no real cure for hemophilia yet, but it's treated by replacing missing blood clotting factors via injection. So there's two types of this. It would be episodic, used to stop bleeding episodes, and prophylactic, used to prevent episodes from occurring. So clotting factor products they use are plasma-derived factor concentrates, as well as recombinant factor concentrates. People with hemophilia might want to consider going to a HTC, Hemophilia Treatment Center, where there are specialized healthcare providers, and they provide care and education to the patients as well as the families. Okay, so some advanced research that they're doing on hemophilia would be gene therapy as a way to treat it. They've been developing improved lentiviral gutless adenovirus and alternate AAV serotype vectors in progress gene repair, as well as RNA repair. Offers opportunities for treatment of hemophilia. This is nice because they can use gene therapy in order to actually add a new gene to targeted cells that can produce the proteins needed for homeostasis. So it can also be used as gene-modified stem cell therapy, may become available to people in the future. They've also determined in studies that organs other than the liver can be used to produce clotting factors. So gene therapy, very promising research on gene therapy that could possibly change the way people are treated for hemophilia, and even cure them in some cases if they're able to add a gene that can produce the clotting factors that would relieve the symptoms. So thank you very much. That was my presentation. I hope you enjoyed it.